Hi, I'm Dr. Minh Huynh, Medical Oncologist and Medical Director for NantHealth. We're going to talk about mitigating provider abrasion and aligning the goals of payer and providers. When a member gets cancer, time is critical. All the stakeholders want the same thing, for the member to get timely care that's evidence-based and cost-effective. In a recent ASCO survey, providers reported that on average, it took 5 days to get prior authorization for chemotherapy. What if I told you we could do it in minutes? We can make this happen at NantHealth with Eviti Connect for Oncology. On average, it takes 20 minutes to receive approval, with an average turnaround time of less than 15 hours when additional review is needed. And nearly 9% of cases are easily validated with evidence-based standards. With the right technology, members can begin their treatment without delay. Sometimes a submitted treatment plan doesn't yet meet the required level of evidence that's been provided. When that happens, it's important for oncologists to be able to speak to another oncologist. These specially matched peer-to-peers lessens the burden of authorization. It allows the provider to speak to another oncologist that can review the data, discuss alternatives, and when necessary, advocate for a medically justified variance. For instance, in a heartbreaking case, we had a 19-year-old with a recurrent B-cell acute lymphocytic leukemia. The patient had been heavily pretreated and in fact also got CAR T therapy, but still had residual disease. The provider wanted to retreat the patient with additional CAR T cells. At the time of peer-to-peer, we reviewed the evidence. We reviewed clinical trial options and alternatives. And unfortunately, the patient still did not meet the threshold for authorization, nor a medically justified variant. Despite lacking strong clinical evidence or guideline support, we felt this case was unique enough. Our chief medical officer called over to the medical director from the health plan to discuss the case, including alternatives and consideration for compassionate authorization. A provider's time is incredibly valuable, and so a collaborative discussion has to happen on their terms. At NantHealth, an oncologist is available 12 hours a day. It's possible for providers and payers to align goals. Providers want timely, appropriate care for their patients, and you as a payer can help alleviate some of these challenges by speeding time to authorization and allowing for a truly collaborative process through Eviti Connect for Oncology.